Hello and welcome to the Emergency Bug Out Med Kit. If you're into disaster preparedness, you probably already have a first aid kit. The problem is most first aid kits are pretty inadequate. That's why I always put together my own. The following first aid bug out kit is based on my own experiences. My medical training consists of 3 years working as a first aid and CPR instructor for St. John's Ambulance and for the Canadian Heart Foundation. I also trained in martial arts for 25 years and picked up a few tricks from sports medicine and from some of my teachers who were Chinese medical doctors. So you'll see that my kit sort of reflects my background. I started off with a small duffel-sized bag. This one's red so that you can tell that it's going to be emergency supplies. This thing has only one tiny pocket on the outside, so I filled the pocket with what I thought would be the most important items you would need. The two most serious medical emergencies you could come across are cardiac arrest or severe bleeding. That's why I keep a triangular bandage, which is useful for applying quick pressure to any severe bleeding, and a CPR face mask. I also have a package of latex gloves. Since I have a little bit of extra room inside the bag, I've stuffed it with everything I could get into it. One of the things I stuffed into it is this little ammo pouch, which is filled with pressure dressings. Pressure dressings are really good to have. If you're dealing with anything more serious than a paper cut, you're probably going to want to use a pressure dressing on it. A pressure dressing is a large absorbent pad attached to usually a gauze-style bandage so that you can apply the pad directly over the wound and then use the gauze bandage to wrap it around and keep it firmly and snugly in place. I've also got an extra bottle of disinfectant. This is known as Dettol here in Canada, but I don't think it's available in the United States. Next in the bag is a fishing-style tackle box, which I've repurposed to hold my first aid supplies. I keep the things that you would need to treat small injuries on the top shelf, so you don't have to open up the whole box just to get a Band-Aid. Working from left to right, I've got here some Band-Aids, more disinfectant, a little clip-on flashlight, and spare batteries. This is a good addition to a first aid kit so that you can see what you're looking for in case you don't have power. Underneath the flashlight, I have some butterfly bandages. Over here I've got rolls of gauze bandage, more gauze bandage, a roll of medical tape, some really large bandages. These are the elastoplast style bandages. These are bottles of antibiotics I was prescribed. I had the prescription renewed and I kept the extras in the first aid case in case of emergencies. Since I've already been prescribed these antibiotics, I know I'm safe to take them. Here's some Q-tips and some tweezers, which are really handy for pulling out slivers. Actually, I have 2 sets of tweezers. Actually, I have 4 sets, as we'll see later. This is a pack of safety razors in case you have to cut away clothing. Oh, and I also have a magnifying glass here, which is also helpful for looking at wounds and trying to find out where the sliver went in. Okay, so now we're opening up the tackle box and we're going to go on to the second shelf. This is a vial of medicated eye wash for treating eye injuries. I also have an irrigation syringe, which is good for cleaning the dirt and debris that may have gotten into your eyes. Next, we have a package of water purification tablets and a package of potassium iodide, which is used for treating radiation sickness. This is a package of Chinese herbal tea, which is good for helping calm the nerves and making people feel better. I also have a couple of bottles of Yunnan Baiyao, which is a blood clotting powder that you can pour into a scrape or an open wound, and it will help stop the bleeding and also disinfect the wound at the same time. And this is another vial of blood clotting powder. I also have a couple of angle-nosed irrigation syringes. You fill these with a saline solution or a disinfectant, and they're really good for irrigating and cleaning out deep lacerations. I also have a syringe and a couple of needles. I don't really know why, because I have nothing to go into them. This is some prescription antibiotic cream, and over here is another tube of antibiotic cream. This is a small eye injury kit. It includes some more eye rinse and a bandage for the eye and an eye patch. So I'm somewhat equipped to handle eye injuries, and in many disaster scenarios, eye injuries would be a common occurrence. This is some elastoplast bandage in one long roll, so you can cut it to fit the size that you need. This stuff is pretty tough, and it's good for outdoors because it sticks and it doesn't come off easily. I also have a couple of tablets of Benadryl. These are good for treating allergic reactions. This is a bottle of Second Skin. It's supposed to be good for treating burns, but I've never really used it. Actually, I don't even know where I got this from. The next three compartments are taken up with roller gauze bandages. I have an assortment of sizes. It may seem like I'm going overboard on these, but when you are treating an injury, and especially a seeping wound or an infected wound, you go through a lot of clean bandages quickly. I also have a couple of rolls of elastic tensor bandages. These are vital for wrapping up a sprained ankle or a sprained knee. Oh, I almost forgot. Tucked in behind this gauze bandage is a mercury thermometer. Over in the last compartment, I have again some antibiotic cream. And this is a package of ammonium nitrate. These are those capsules that you break and whiff underneath the nose of somebody who's unconscious to see if you can revive them. I've personally never used any of these, and I don't know anyone who ever did, and I don't know where I got hold of those things, but they're in the kit anyways. I have a lot of these little packets of disinfectant wipes, and they're okay for minor uses, but I find that they do tend to dry out and evaporate after a couple of years. That's why I keep a couple of bottles of disinfectant. You've seen the Dettol that I pulled out earlier. I also keep a bottle of hydrogen peroxide in there, which I haven't shown you yet. And in the bottom of the kit is another bottle of isopropyl alcohol. So I have plenty of disinfectant, and I don't really need to use these little packets. Here and elsewhere in the kit, I have a couple of dozen gauze pads. Again, in a serious disaster situation, you're going to go through a lot of bandages quickly. So I've got as many as I could stuff into this kit. Here's another eye patch, some more 4x4 gauze pads, and a couple of dozen more disinfectant wipes. These are surgical masks. And these are two sets of sterilized surgical gloves. And this is an extra large roll of gauze bandage. Another triangular bandage. Triangular bandages are really useful items to have in a first aid kit, and throughout this kit I have 3 in total. I also carry 3 rolls of sports tape. I've used these before to bandage up hands and ankles. I'm confident that I could improvise a pretty sturdy and durable cast using just the sports tape and maybe some sticks and some padding. However, you've really got to know what you're doing when you're taping something up, and if you don't have any experience doing this before, I wouldn't recommend you try it. I have 1 Vaseline impregnated burn dressing, which you would use to treat only a 3rd-degree burn. In any serious disaster, having only 1 burn dressing would be woefully inadequate. But since I'm trying to cover a lot of ground with a minimum amount of space, I'm afraid I'm going to be reduced to just 1 burn dressing. Next up is a suture kit. This is used for sewing together wounds that are too deep or too long to be held together with butterfly bandages. I personally wouldn't attempt this unless it was absolutely necessary, and only in a situation where there was no chance of help arriving on time. Inside the kit is a needle holder, a scalpel, a suture, and a pair of tweezers, which brings my total number of tweezers in the kit to be 3 so far. This is an extra large gauze pad used to treat abdominal wounds. And this is a pump bottle of burn spray, which helps numb the pain and also disinfects the burn area. This is a small tackle box which I've repurposed to be a pill container. In it I keep a bunch of prescription pills that both my wife and I have used. Inside are antibiotics, some prescription painkillers, some antihistamines, some hormone tablets for the wife, and an assortment of other tablets that we thought might come in handy in case of an emergency. This is another tackle box which I've repurposed to contain a dental kit. As you can see, we have a dental pick, a mirror, and some dental putty. This stuff really works. You can roll it into a small ball between your fingers and then stick it into the hole left by a missing filling or a cavity. It'll stay in place for a couple of months. I also have some oral gel analgesic, which you can rub on a tooth if you have a toothache. This is some dental cement. If you have crowns and if you were to lose one, you could glue it back on with this. Here's another packet of oral gel. And finally, the bottle of isopropyl alcohol, which you can use as a disinfectant. And finally, we come to the surgical kit. Now, this is actually a piece of crap that's made in China. And the only reason I have it is as a absolutely last resort. It's basically a suture kit. It contains most of the parts of the other suture kit that I carry, and the other one is of a much better quality since it is hospital grade. But as a backup, I can always resort to this one. It includes a needle holder, a hemostat, which is basically a pair of scissors that you can lock into place and is used to close off an artery, although I doubt I could ever imagine myself using this. I replaced the original scalpel with this hospital-grade scalpel, and I also included a bunch of extra sutures. And finally, it has another set of tweezers, bringing my total number of tweezers to 4. So that's my emergency medical kit. There are a lot of items I wish I had, but unfortunately it's illegal for me to possess them. Such items would be an EpiPen and some Novocaine. I'd even like to have a couple of shots of morphine. I hope this video has given you some ideas for putting together your own medical kit and maybe inspired you to take some advanced first aid training. So thanks for watching and be safe.